In the video series of neurology medicine, today I will discuss headache. So first of all, we should know how we can define headache. So headache, it is a painful sensation. It is a painful sensation in any part of head, ranging from sharp to dull. So how we can classify headache? We can classify headache as primary headache, which is also called as benign headache, and secondary headache, which is called as malignant headache. Primary headache, it is not due to disease, rather it is mainly due to stress, right? It is mainly due to stress, depression, and those individuals whose needs are not fulfilled, like in state of fasting. So it's very important. In the case of primary headache, there will be no past history of any disease, and the most important is primary headache is recurrent. Primary headache is recurrent. Now if I talk about the secondary headache, it is mainly due to underlying pathologies. Most commonly it is because of intracranial tumors. Most commonly it is because of intracranial tumors, and also it is due to infections. So in infections, there might be meningitis or encephalitis. It could lead to secondary headache. Also the cerebral venous sinus thrombosis and the giant cell arteritis. Let's talk about types of headache. So there are a lot of types of headache, but mainly there are four types of headache. And what are those main types? That is, the first is sinus headache. Second is tension headache, migraine headache, and cluster headache. So what are the main types of headache? That is sinus headache, tension headache, migraine headache, and cluster headache. So the most common type of headache, that is tension headache. Always keep in mind, the most common type of headache is tension headache, while if I say the second most common type of headache, that is migraine headache. It is sinus headache. So there are four sinuses in the facial area. So there might be frontal sinuses, ethmoidal sinuses, maxillary sinuses, and sphenoidal sinuses, right? So what is sinus? Sinus is an empty space which is filled with air. So whenever there is accumulation of mucus, so it lead to infection, which ultimately lead to sinus headache. So mainly the sinus headache, it is presented with the frontal headache, and there might be an involvement of nasofacial area. So the most important is what are the timing duration of sinus headache. So it lasts for 10 to 15 days. So what are the major symptoms of sinus headache? That is runny nose, congestion, nasal obstruction, and fever, right? So it's a just overview of sinus headache. So sinus headache is most commonly it is involves the frontal headache, and it involves the frontal area, and it involves the nasofacial area. So first of all, tension headache, it is the most common type. It is the most common type of headache. Now, what are the time duration of the tension headache? So the time duration is It lasts for the 15 to 30 minutes. So the pain in the tension headache, it involves mostly the one side of head. So mostly it is presented with unilateral pain, right? So there is the pain and the tension headache is constant. There will be constant pain and it is mainly unilateral headache. The pain is described as a tight band-like pressure over the head area, right? So it's a feeling of sensation of like a tight band in case of tension headache. But the most important is it is not associated with the nausea, vomiting, and phenophobia or photophobia, right? So there will be tight band-like pressure, feel in the head area, but not associated with nausea, vomiting, photophobia, or phenophobia. The most important is that in tension headache, it do not interrupt your daily activities. So there is pain, but that will not interrupt your daily activities. Now, how you will treat the tension headache? So, in order to treat the tension headache, there are two categories. That is episodic tension headache and there is chronic tension headache. Now what does it mean? It means that if there are tension headache 15 times or less than 15 times per month, so that is episodic tension headache. But if the tension headache is more than 15 times in a month, so that is chronic headache. So if there is episodic tension headache, so in that condition you have to give the paracetamol and you can give NSAIDs and you can check the hydration status of a patient. Also you can advise exercise. But if there is chronic tension headache, in that condition you have to give the TCA, that is tricyclic antidepressant. Most commonly you will give the amitriptyline, or you can give selective serotonin reuptake inhibitors, and you can give the fluoxetine. While in some literature it also shown the benzodiazepine play some role in case of tension headache. Migraine headache, second most common type of headache. So it is the second most common type of headache, and usually in migraine headache it involves the one side of the head. So right, if this is a person, so it involves either the right side or it involves the left side. So mainly there will be unilateral headache. Along with the unilateral headache, there might be involvement of neck. So neck involvement can be seen in the migraine. But the unilateral headache, that is in case of migraine, it is always associated with the nausea or vomiting, or it could associated with photophobia or phenophobia. That is important. Well, if already we discussed in the tension headache, that in tension headache also there will be bilateral involvement, and that is not associated with the nausea or vomiting. But in case of migraine, it mostly involves the unilateral headache along with nausea, vomiting, photophobia, and phenophobia. It lasts for the longer period of time. It lasts for 4 hours to 72 hours. What are the types of migraine? So there are two types of migraine. That is migraine without aura and migraine with aura. So in migraine without aura, it is also called as common migraine because it is most commonly seen in 80% patient, while the migraine with aura is also called as classical migraine, and it is present in 20% cases. So in migraine without aura, in this condition, the patient usually presented with unilateral headache with nausea or vomiting, but there are no aura. but in case of this condition the patient is manifested with aura. So basically, what is aura? It is the presence of zigzag line across the visual fields that is called as scotoma. So how you will treat the migraine condition? So if there is acute condition, then you have to give the paracetamol or NSAIDs. But if the patient is not respond to such medication, so in that condition you have to give the triptans, that is mostly somatotriptans. You have to give the paracetamol and NSAIDs, while in severe condition you have to give the triptans, mainly somatotriptans. And what are the preventions for the migraines? If I talk about preventions, so it is divided into two categories, that is first line drugs and second line drugs. So in the first line drugs, it consists of beta blocker and TCA, while in case of second line drugs, that is anticonvulsant, topiramate. Now let's talk about cluster headache. Now first of all, you should know that this cluster headache, it is also called as suicidal headache because of the excruciating pain. So also in cluster headache, it involves the one side of the head, either it involves the right side or it involves the left side. So this patient mainly it presented with the unilateral headache, but along with unilateral headache there are eye involvement. So eye involvement is very important in case of cluster headache. So let's say if the patient right side of the head is affected, so ipsilaterally it will affect the right eye, but if there is left head involvement are there, so it will affect the left eye, right? So and there will be in eye involvement, there will be ipsilateral periorbital pain, or there might be lacrimation, ipsilateral lacrimation, or myiasis, or ptosis, or congestion. So there will be unilateral headache along with eye manifestation. So the most important is that the cluster headache, it is considered as the most dangerous type of headache, and it usually lasts for months to years, right? It lasts for months to years, and it is the most dangerous type of headache. Now how you will treat the cluster headache? You will treat the cluster headache by giving the inhalational 100% oxygen therapy, right? So the treatment for the cluster headache is 100% inhalational oxygen therapy. And how you will prevent such condition? So you will prevent such condition by giving verapamil, lithium, topiramate, and deep brain nerve stimulation. Now, if you see this structure, so this is sinus headache. In sinus headache, the pain is localized to frontal area and pain will be localized to the nasofacial area. But if I talk about cluster headache, and cluster headache, the pain is usually in the unilateral side. Along with that, there is periorbital involvement is there. Now, in tension headache, that pain is localized to the frontal area and there will be bilateral headache. In migraine headache, it involves mostly the unilateral side of the headache, either right side or left side. Along with that, it can involve the neck area as well. So student, that's all about the headache.